The African region is pleased to join the celebration of the first World Immunization Week. The success of last year's first ever African Vaccination Week has brought renewed opportunities to protect people's health through vaccination. 40 out of 46 member states in the African region took part in leveraging the mobilization of people to participate in this landmark event. This year, our focus is to interrupt the transmission of wild poliovirus, expand the use of existing vaccines, and scale up the introduction of new ones in order to accelerate progress towards the Millennium Development Goal 4. Vaccination is an investment for children's health. Get vaccinated. Protect your world.
Vaccination is a powerful and efficient tool for preventing infectious and viral diseases and reducing the risks of epidemics. WHO estimates that vaccination prevents 2 to 3 million deaths each year, including polio-related deaths.
I've been living with polio since I was a child. Polio is a harmful disease. The present generation shouldn't fall in this abyss.
Polio is a highly infectious disease which is caused by a virus. The wild polio virus is transmitted through contaminated food and water. It multiplies in the intestine, from where it can invade the nervous system. Initial symptoms are fever, fatigue, headache, vomiting, stiffness in the neck, and pain in the limbs. Polio can cause paralysis in a matter of hours. Since 1988, the year of the launch of the Global Polio Eradication Initiative, the number of polio cases has drastically reduced.
Aujourd'hui, nous avons fait des progrès énormes.
The world has made good progress towards polio eradication. Globally, the number of polio cases has drastically reduced by over 99%. In 2011, the African region recorded only 350 polio cases. Thus, the world, particularly the African region, has come a long way in the fight against this disease. The only efficient tool available to combat the disease is vaccination.
The World Health Organization recommends that children be vaccinated against polio at birth and at 6, 10, and 14 weeks. Still, additional doses can be provided if necessary. Destiny was 4 days old when we met her and her family. Right after birth, she was vaccinated against polio.
It's absolutely necessary that our children be vaccinated.
Because they are vulnerable, getting our children vaccinated protects them against many diseases.
Like Destiny, whose parents dream to see her grow in good health, thousands of children in the African region are vaccinated every day against polio. The African Vaccination Week is a good opportunity for accelerating the polio eradication process. Following last year's successful celebration of the event, this year's African Vaccination Week is to be commemorated under the theme, "An Unimmunized Child is One Too Many. Give polio the final push."
Giving polio the last push is now a reality if you closely observe the progress made in the polio eradication effort in recent years. For example, Nigeria, which is the only country endemic for polio, has reduced the number of wild polio virus cases by 95%. Other countries like Angola, the Democratic Republic of Congo, and Chad, where polio virus is still circulating, have put in place emergency plans supported by the highest national authorities. The heads of states have committed themselves to stopping the circulation of wild polio virus by investing substantial resources to make this happen. It is also important to stress the continuing support of the international community to our region's polio eradication efforts.
The African Vaccination Week is a regional initiative led and coordinated by the World Health Organization Regional Office for Africa and implemented by countries in the region. The focus of the African Vaccination Week is on strengthening national immunization programs by raising awareness on the value and importance of immunization and increasing vaccination coverage and uptake of new and existing vaccines, while at the same time prioritizing service provision for hard-to-reach areas.
During
the African Vaccination Week, we'll be talking not only about vaccination, but we will also advocate for member states to commit themselves to contribute significantly to enhance immunization programs. We'll also mobilize communities and raise awareness among them on the benefits of immunization.
Mais également à ce que les communautés elles-mêmes soient sensibilisées aux bienfaits de la vaccination.
Parents shouldn't hesitate to get their children vaccinated, especially as this campaign is free.
We have organized outreach strategies. This is why many people come at the health center.
We are actually organizing polio vaccination activities. People come to get vaccinated.
Let's get our children vaccinated to save lives.
To stop transmission of the wild polio virus and optimize the benefits of polio eradication, the priorities are, among others, stopping wild polio virus transmission, putting an end to re-established transmission, preventing new outbreaks, and mobilizing financial, technical, and human resources.
There is need to put in place efficient immunization systems, but efficient does not only mean availability of vaccines. Availability of cold chain make for an efficient immunization system.
An unimmunized child is one too many. Give polio the final push.
La polio a été déclarée par les ministres de la Santé de notre région comme une urgence programmatique.
Ministers of health of our region have declared polio a programmatic emergency. The regional director himself took the lead to translate the declaration into concrete action. The regional office is currently implementing an emergency action plan to address the polio threat on a daily basis, and also to implement strategic and innovative actions at country level to stop polio once and for all.
En finir encore une fois pour toutes avec la polio.
Il y a lieu d'inviter l'ensemble des partenaires.
We invite all partners to continue to support WHO and to continue to finance its operations, because we cannot allow the creation of white elephants. We have no option but to succeed in the mission of saving mothers and children from health problems which are common in our continent.
Pour des problèmes de santé qui sont récurrents dans notre continent.
As long as a single child remains infected with polio, children in all countries are at risk of contracting the disease. Once polio is eradicated, major public health benefits will be accomplished. In addition to humanitarian benefits, economic modeling has found that the eradication of polio in the next 5 years would save at least 40 to 50 billion US dollars.
Les perspectives, bien sûr, ça sera.
The perspectives will consist of continuing to support countries and to implement initiatives underway, particularly the 5 components of the initiative known as Reaching Every District. We think that by targeting provinces and districts where there are more children who are not immunized, we will reach the objectives which we have set to attain by 2015.
Arriver à atteindre nos objectifs que nous nous sommes fixés d'ici 2015.
Call upon governments to intensify their efforts to achieve 100% polio eradication.
Éradiquons la polio à 100%.
I live with it. I had the chance to go to school. I work and I have a family to take care of. I'm also a musician. I have established an orchestra for people living with disabilities so that they can also commit themselves to some ideal with regard to people living with disabilities.
It has been a year since we met Destiny and her family. We paid them a visit recently. Destiny has grown up and she's doing fine.
She was vaccinated against polio immediately after birth. She was again vaccinated when she attained the age of 6, 10 weeks, and 14 weeks.
She is 14 months and she eats well. She's in good health. She has started walking.
Have you heard about Vaccination Week?
Regarding African Vaccination Week, I've heard about it, but I don't really know what it is about. We'll go to the health center to find out how this week can be of benefit to our children, my wife and myself.
Pour l'enfant, pour ma femme et pour moi-même.